Namaste. I am Dr. Vishal Mukherjee. I am cancer surgeon at Open Hill Cancer Hospital. Today, the topic of our discussion is the role of minimal access surgery in gynecological cancers. That is, as we are moving towards the age of laparoscopy, and now we are moving into coming to an age of robotic surgery. So, what are the advantages of this minimal access surgery in gynecological cancers, or rather any cancers in our body? So, most important is the recovery. The recovery after the operation is very fast, short. There is obviously very less pain and there is very less requirement of giving any analgesic like any anti-pain drugs. And usually the return of the bowel functions, the patient returning to their normal life, returning to the normal activity. So everything, even the number of hospital stay, sometimes in case of a large operation, the number of blood required during the surgery, everything is minimized with the minimal access surgery, that is either a laparoscopic surgery or a robotic surgery. So in gynecological cancer, we have the three big cancer. First is the ovary, which is usually the most common one. Then we have the cervix, which is even commoner in this part of the country. And we have the carcinoma of the endometrium or the uterus. So first, coming to the cancer of the ovary. So what is the role of laparoscopy? So laparoscopy helps in case of ovary to detect how much the disease has spread inside the abdomen, whether it is located just between the ovaries or it has spread to some parts of the abdomen or even in some parts of the liver or in other parts which are too far from the ovary. So by just doing a laparoscopy, we can get an idea how far the disease have spread. So based on this finding, we can get an idea whether we can totally remove the tumor or we have to give a chemotherapy first, then reassess and then do the surgery. So there is a role of laparoscopic surgery in case of diagnosing and staging of a carcinoma of the ovary. Moving on to cancer of the cervix. So cancer of the cervix, the role of minimal access surgery was unfortunately till now has not been so good. So far we have done in case of very early cervical cancers, we normally go for a radical surgery, that is called a radical hysterectomy. But based on few trials which have been done in different parts of the world, it has been shown that the rates of recurrence, the rates of residual tumors are a little bit higher in case of a laparoscopic surgery as well as in case of a robotic surgery. Though there are few newer trials which are being carried out in different parts of the world, because the previous trials which was done were done in some not specialized center, not specialized in doing the procedure. So we are coming up with those trials so that the role of laparoscopic surgery and minimal access surgery in cervix can be established. But till now, it is still the open surgery which is the standard of care for cervical cancer. Lastly, the cancer of the uterus. So cancer of the uterus, the role of laparoscopic surgery is actually established. It has been shown that if a patient is suffering from a cancer of the uterus, then you should go for a laparoscopic surgery. There are advantages of laparoscopy over the open surgery, like I told you, regarding the pain, return to the normal activity, and the results of cancers and results of survivals are mostly similar. So we are moving forward towards the laparoscopic and robotic surgery. In bottom line, I can say in a gist that the role of minimal access surgery in gynecological cancers are coming up, but still not fully approved, so that we can say that laparoscopic surgery is the only way out. Thank you.